Hi everyone. Today we're going to talk about the respiratory system. We're going to start off with some anatomy of the lungs, shown here struggling while a runner is running along with heart, poor little heart. And then we're going to go into the histology and then some pathologies of the respiratory system. So first let's talk about the functions of the respiratory system. The number one function, of course, is gas exchange, to get oxygen into the blood and carbon dioxide out of the blood. But there are other things that need to happen as well. One of those is gas conditioning, which is the air coming in needs to be warmed up to body temperature, humidified because the oxygen needs to be dissolved in water in order to be transported in the bloodstream. And the air needs to have all of the particulates removed from it. So we're going to talk about the different ways in which the structures of the respiratory system do all these things. The respiratory system is also going to be responsible for sound production, olfaction or smell, we've already talked about that one, and defending against pathogens. So we're going to talk about all of these things in a series of lectures today. So the respiratory tract is divided into an upper respiratory tract and a lower respiratory tract. And they divide right here where the epiglottis closes over the top of the trachea. The upper respiratory tract includes the sinuses around the nasal cavity itself, and then the pharynx, which you can just think of it as the throat area behind the nose and the mouth. Then the lower respiratory tract starts with the larynx. That's this area here that includes the vocal cords. Then the trachea, and then bronchi that branch throughout the lungs, and then the lung tissue themselves. The respiratory system is also divided into a conducting portion, and that starts with the nose and then the nasal cavity, the pharynx, the larynx, the trachea, all of the bronchi, and then the smaller branches, the smallest branches, which are bronchioles. All of those are going to transport air through increasingly smaller and smaller branches to the respiratory portion where gas exchange is actually going to happen. So here we have the lungs showing the bronchi branching, and then think of each of these branches as making smaller and smaller branches, and then finally ending in these tiny bronchioles, which run alongside branches of the pulmonary artery. And each of these then enters a pulmonary sac, shown here. That's what this little thing is. And then with the connective tissue taken off of that little pulmonary sac, we can see all the alveoli inside. Those alveoli are the little air sacs where gas exchange actually happens. There's a little bit of gas exchange that happens in the respiratory bronchioles and in the alveolar ducts, but mostly it's these alveoli that do the job of respiratory exchange. Now let's talk about the difference between the lungs themselves. The right lung, you see, has 3 lobes. The left lung has 2 lobes, cleverly named superior, middle, and inferior, and superior and inferior. Yeah, I know. Both lungs have an oblique fissure dividing the superior and inferior lobes. And then the right lung also has this horizontal fissure separating the superior from the middle lobe. And then the left lung has this little cardiac notch here, which makes a little bit of space for the heart. This is the lateral view of the lungs. We're looking from the sides. When we look at the other side, the medial side, what we see is this indented area called the hilum, where the blood vessels come and go, and where the bronchi enter. So the main bronchi, right and left, enter and exit here at the hilum. And then there is in the left lung a further indentation called the cardiac impression. That's right behind that cardiac notch. And again, that leaves space for that apex of the heart. I'm going to stop there, and on the next one we will talk about how the heart is suspended in the chest cavity.